All right, welcome everybody. I am Dr. Elena Klimenko, and this session is recorded. And I'm just trying to put my name, my face on it. Okay, so people know that I'm speaking, and it's not a robot or AI that will be soon replacing all of us to some extent, but hopefully not to just with the help of us, not to destroy us. But anyway, so today we're going to be talking about a very interesting topic of why do people get this burning sensation in their or heartburn that sometimes can be interpreted as a chest pain and heart attack, and it's really common. What do we know about it, and how can we address it from the functional medicine standpoint? Because we're also going to be talking about some of the conventional medicine approaches and how it is different one from another. So I'm Dr. Elena Klimenko. I'm a functional medicine physician in New York City, and I'm really happy to see you all today. So this is our agenda. This is what we're going to be talking about today. What is GERD? That's the term we use in medicine, abbreviation of gastroesophageal reflux disease. What kind of symptoms, what can cause it, how can we recognize it in our patients or in our friends, family members, and ourselves. What are their proton pump inhibitors, so medication that is probably one of the most common medications prescribed in primary care or in other settings. So, and what are the complications of those PPIs? We'll talk about the typical case scenario and how to support patients through the process of either weaning them off or the PPI's medications, or help them with the symptoms that could be very disturbing. And we'll briefly talk about our GI health program that we are offering to our clients. So let's jump right in and talk about gastroesophageal reflux disease, or GERD. So GERD is also known as the acid reflux that happens then when the valve or the sphincter that separates the esophagus or the tube that connects our mouth to our stomach becomes relaxed or weak, and it doesn't close properly. And as a result, the food that is being digested in the stomach starts regurgitating into their esophagus, and we get this sensation of burning or discomfort or tightness. And because the acidic content of the stomach is pretty erosive to our esophagus, to the gentle mucosa of their esophagus, and sometimes this reflux is so pronounced that it can go up to the mouth and cause their mouth symptoms like sore throat or choking sensation, or even like postnasal drip. Sometimes even the sensation of lump in the throat. So this acid can be very irritating because their normal pH of the stomach is anywhere from 1 to 2, which is pretty acidic. And the normal pH of the esophagus is around 7, 8. So you can imagine how mucosa of esophagus being so gentle and not adapted to their very acidic environment can react by ulcerations and irritation, and finally even damage over the time. So, and of course, one of the symptoms can be a sour taste in the mouth. It's not the only symptom, of course, but it could be one of them. So it's statistically, we know that GERD affects 20% of the population in the United States. So it's pretty common, right? And it actually affects adults more than children, but we see more and more of it even in children. And probably one of the most common pathology in newborn babies having this GERD and reflux disease. And so this picture actually explains in the picture explains how the GERD occurs and how it affects our symptoms. So this is their valve or their low esophageal sphincter. So this is the esophagus, this is the stomach and the food content in the stomach. And usually we have all these enzymes and other wonderful digestive ads like stomach acid. The lower esophageal sphincter that you can see on the picture normally stays closed, right? And then in some condition, it becomes relaxed, and their stomach contents start regurgitating into their, or refluxing into their esophagus and causing all the symptoms that we are talking about. So that's basically what happens when you experience the heartburn or sour sensation in your mouth. So some people are more at risk than others. People over 40 usually have a higher risk of having these symptoms or this disease. Overweight or obese individuals have a higher risk, though, to experience it as well. And also lifestyle, poor eating habits. Things like going hungry all day and eating at the end of the day, large meal, and then going straight to the bed, really not the safest or healthiest life habit. Or preferring fried foods and dairy products or spicy food will also affect the esophageal sphincter. But also things like coffee, right, that we all love and enjoy. Sometimes in a large quantity, coffee can cause a lot of those symptoms as well. So certain use of certain medications will cause it, of course. Prolonged stress. Of course, as you know, when we're in stressful, sympathetic tone, and we are in fight or flight response, our digestive system is basically not working. And imagine you are piling all this food in your stomach and there's no digestion. There is no digestive enzymes. There's no digestive juices. So the food is just sitting there. And then right after that, you go and lay down. Of course, that undigested food will be creating a lot of issues and will be a huge contributor to the GERD symptoms. But also it could be structural issues. For example, hiatal hernia. Hiatal hernia is actually a very common condition, and anyone who experiences that, I would always refer them to their chiropractors, because chiropractic medicine can help a lot with hiatal hernia, and good chiropractors will even teach you how to do this maneuver to repair, or not repair, but restore the integrity of the gastrointestinal tract and help with the hiatal hernia. When we have too much pressure on the abdomen, for example, a condition like pregnancy can definitely contribute to and be a risk factor for GERD, and of course, smoking. But even like a tight band in your pants or in your skirt can be that factor that increases the intra-abdominal pressure. So what are the symptoms of their GERD? As you can see here, it can be sensation of the chest pain, especially after eating. It could be it can vary from mild to severe and even stabbing pain, commonly bringing people to the emergency room with the worries that they have a heart attack. So that actually one of their most common symptom or common reason for many people to come to the emergency room worrying about heart attack with this really difficult sensation in the chest. Could be also difficulty swallowing, especially if the GERD has been there for a while and esophagus undergoes through the structural changes, and people might have some difficulty swallowing food. Sore throat or hoarseness of the voice, especially in the morning, because we are laying down, this stomach content regurgitates to our throat and irritates our vocal cords. Also regurgitation or even vomit, tasting the food, just recently eaten food in the stomach, in the mouth, frequent cough or repeated clearing of the throat, very common symptoms as well. And sometimes people wake up with this coughing sensation because of the reflux and regurgitation of the stomach content. Some people will present with a bad breath or even poor dental health. Sometimes GERD can be diagnosed by the dentist. And tiredness and poor sleeping habits, of course, because people are awakening from this regurgitation. So as you can see there, the range of the symptoms is really wide, and it can be, so GERD has to be always always suspected in many patients with those symptoms. So what is the proton pump inhibitor? So this is a newer drug that is widely prescribed and used to treat GERD. So basically, it's a symptomatic medication. It is just a band-aid on the on the problem, as you can understand. What it does, it blocks the enzymes and production of the gastric acids, and therefore reducing the acidity of the stomach content. It doesn't really work on the lower esophageal sphincter or that valve that separates esophagus from the stomach. It just lowers the stomach acidity or reduces stomach acidity, so it's not so acidic. But it has a huge implementation and side effects, right? Because stomach acid is there for a reason. It's there to digest our food, but also to sterilize the food. So people who are taking PPI will get symptomatic improvement, symptomatic release, but they become addicted to this medicine, unfortunately. And even if you look at the package insert of this medication, PPIs, it says that it should be used for a short period of time, maybe 2 weeks, maybe a month, not longer. But people who are placed on it for a prolonged period of time can have a really difficult consequences and deleterious effect on their health. They will be suffering from hypochlorhydria or low stomach acid, and therefore inability to break down the proteins. They will experience a variety of their malnutrition, like low vitamin B12 absorption, decreased vitamin C synthesis, and also impaired mineral absorption. Minerals like calcium, magnesium, zinc, iron. So what does it all mean? Well, it's all predisposing factors to the chronic diseases like osteoporosis, or like even anxiety or headaches, or inability to properly generate hormones because of the zinc deficiency, or fatigue because of the iron deficiency. So all those nutrients are so essential to us. And imagine people who are taking PPIs for years and years, they become deficient. Moreover, it actually affects your microbiome and increases the risk of infection. So way back then, we knew that people, and elderly especially, who are on PPIs for a prolonged period of time have a higher risk of having Clostridium difficile or C. diff colitis, which is their antibiotic-related gastrointestinal disorder, or community-acquired pneumonia. So it really has a global effect. It affects not just your symptoms of the GERD, but it has a systemic effect and not a good one. But why people just can stop PPI, and we know it's so bad, why can't we just stop it? Unfortunately, it's not that easy. It's almost impossible to quit PPI cold turkey. So because it has not just physiological effect. For example, if you stop it acutely, abruptly, it will create this rebound acidity. So you're basically your stomach cells that produce acid all of a sudden wake up and they start producing stomach acid, and patients will have withdrawal symptoms. So their heartburn will be exaggerated even more than before. But it's also psychological addiction. When people take PPIs and they feel relieved, they feel secure, and they feel comfortable. So they are afraid usually to just stop it. So longer someone takes PPI, the harder to get off this medication. And unfortunately, many doctors don't know how to get people off. They know it's a bad stuff, but there's not a lot of knowledge in conventional medicine how to slowly reduce this medication and how to get people off this PPI medications. And the way we need to do that is to restore normal function of the stomach and slowly reduce the dose. And sometimes we need to switch people to a different medication while we're healing the gastric mucosa and regulating stomach acid production. So what is the PPI withdrawal support? And it's, remember, it is a process. And in functional medicine, we have to really gradually take patients through this process, reducing or tapering the treatments of PPI. Sometimes it takes weeks and months. And by all means, never stop abruptly. So the approach is actually based on slowly allowing the stomach cells to adapt to the controlling acid production and healing the stomach mucosa with their assistance of nutrients, some herbs, and some medications, and of course lifestyle habits. And that's what we do for patients in the functional medicine approach. So how do we do that? We are definitely utilizing the very famous and known 5R gut restoration approach with the targeted supplementation support that will help make positive impact and help to control symptoms, which will give patients security and knowledge that they don't have to suffer through this process. It will enhance the bioavailability and absorption of the nutrients that are so important for balanced stomach acid production. And of course, we are talking about the whole body approach and healing because stomach function hugely depends on our brain function as well. So the 5R, as you probably heard me speaking about this before, involves this 5R stages. So first we remove or eliminate the triggers, the food triggers, or lifestyle choices. We need to remove those so we don't hurt our stomach lining. We eliminate the food that most commonly cause their inflammation in the stomach, things like coffee, caffeinated drinks, lifestyle, of course, not laying down after meal, maybe going through the elimination diet for 6 weeks and reducing the inflammation from food. Of course, we are working on restoring digestive function and giving people what's missing, for example, digestive enzymes that are so important for a faster emptying of the stomach. Because imagine you don't have enzymes or you don't have sufficient amount of their digestive power in your gut. So what happens, the food is just sitting in the stomach and start regurgitating in the esophagus. We also pay special attention to the microbiome, not just microbiome in your intestines, but also microbiome in your stomach. Many of you probably heard about Helicobacter pylori, the bacteria that likes to live in the stomach lining. And many of my patients would come with their symptoms of GERD after going through the endoscopy and being reassured that they don't have H. pylori, and only to learn that more sensitive tests like a stool test that we do will detect that H. pylori. It needs to be addressed because if H. pylori is there in a significant quantity, it will cause ongoing inflammation and ongoing gastritis or symptoms of the reflux and potentiate the symptoms of reflux. So controlling and balancing their microbiome, not only in their in large and small intestine, but also in the stomach, is really essential. And by the way, we do it without antibiotics. We do it with the natural substances, with the herbs, with their nutrients, things like mastic gum and many other things that actually proven to affect H. pylori. So we also work on the healing the gut barrier, right? Things like glutamine, herbs, like marshmallow. We're going to go over that. And of course, the last R in the 5R gut restoration approach is their gut-brain connection. Nothing is working well if your brain is not involved in the process. So we teach our patients how to balance your nervous system so it functions in the most supportive way for your gut function. So let's go over the common case scenario. So usually who presents, not necessarily male, but also female. Usually, as I mentioned, people after 40, 50. Overweight people are much more prone to their GERD than people of normal, healthy body weight. And people will present with a chest pain after eating, frequent coughing, frequent clearing the throat, difficulty sleeping because of this. Regurgitation mostly happens at night. And of course, they wake up and they're tired. And the day is really not a good day after that. So, so this is like the typical case scenario that people will present with a prolonged chest pain after eating, and especially when they're laying down. And by the way, if you have to lay down after meal, remember that you want to lay down on the left side, on the side of your heart, actually, because that's the most physiologically supportive position. So the stomach is not flipped and push the stomach content into your esophagus. So you want to stay on the left side, maybe with their elevated head side of the bed. So overeating, especially with the spicy food and fried starches for some reason have especially big affinity for causing these GERD symptoms. Things like pasta, lots of potatoes or French fries or pizza. Well, basically everything that we're trying to stir our patients away from. Frequent coughing and clearing the phlegm in the throat. That phlegm is actually their stomach content regurgitating in the throat. Hoarse voice from all the coughing and from the irritation of the vocal cords from the acidic content of the stomach. And usually people have the first remedy people implement is just drinking some water, but it doesn't really help. It feels like the mucus is so thick it just sticks into your throat. And of course, people would wake up, they would have difficulty of sleeping, they might also have sleep apnea, snoring, and they might even develop asthma because this acidic content is regurgitating and we're aspirating it, and that creates irritation of the airways. And usually these patients have variety of the medications in, and it could be not necessarily PPI, but variety of other meds. So when people with these symptoms approach conventional physician, either primary care or even gastroenterologist, usually the several expensive tests are ordered. It's usually, I call it $1 million workup. So people would have upper GI endoscopy, sometimes x-rays, sometimes they even go through the biopsy, and which has a risk of bleeding, of course. There's a variety of the tests, the probes that can measure acidity in the esophagus and in the stomach, and functionality tests of the lower esophageal sphincter or esophageal muscles. All of those are very important to diagnose. However, the treatment in conventional care is pretty redundant or very, very limited. So PPIs, as I mentioned, this is their brand names of all the very famous proton pump inhibitors that are on the market, or there's another group of medication that is a little more gentle. We call it H2 blocker or histamine 2 receptor blocker. They're also pretty efficient in decreasing the acid production. And there's also some anti-acid or neutralizing stomach acid over-the-counter medication you're probably all familiar with. And sometimes even things like baclofen can be used to relax, to reduce the relaxation of the stomach wall. And believe it or not, some people end up under surgical care or even implementation of the magnetic device that is staying locally to keep the tonus of that sphincter valve in the optimal level. So how is the functional medicine approach different? So if the patient decides to see functional medicine doctor and get some root cause answered or addressed or identified, then we go through a very thorough history and physical. We do the thorough laboratory workup, not just blood tests, but also stool tests. As I mentioned before, we do a very sophisticated stool test that looks at their how are you digesting your food? Do you have inflammation in your gut? How's your immune system works in your gut level? Do you have a microbial overgrowth? Are your beneficial microbes in the good level or not good level? So this is all very important because sometimes addressing overgrowth of the yeast in the lower intestine will help people with their reflux. We also, of course, doing the blood panel, identifying nutritional deficiencies and consequences of nutritional deficiencies like anemia that could be from various causes, not just iron deficiency, but could be folic acid or B12. We have a really sophisticated micronutrients analysis that looks at their not just blood test nutrients, but also intracellular nutrients. And as I always explain, the intracellular nutrients status shows you your true nutritional status, your storage of your nutrients. Because if you are in stress or there's some dire stress situation, your body can handle a lot of it if it has a lot of nutrients. And if it has it, the storages of the nutrients are filled. So that's why it's very important not just look at their nutrients in the bloodstream, but also inside of their red blood cells or white blood cells. And that's the test we usually do. We look at both in the blood and in their intracellular. I always make a analogy of, the intracellular, the nutrients in the blood is what is it's the cash in your pocket, right? It could be sufficient for you to go by today, but what is in your safety deposit or in your safety account in the bank is what determines your ability to sustain difficult times. So the same thing with the nutrients. If you have enough in the intracellular space nutrients, you can sustain a lot of issues in life. So what are the other things we do in the functional medicine? Besides testing, we of course do the targeted nutritional support. So identifying nutritional deficiency with those tests that I mentioned would be a really good place to start. But also at the same time, we like to heal the esophageal lining that is so inflamed and causing so much problem. Glutamine is amino acid, one of the most abundant amino acid in our body that is a great product and gives people sometimes immediate relief of the symptoms of the GERD. We also like to protect and soothe the area of the esophagus with their herbs like diglycerinated licorice or DGL, marshmallow root, and slippery elm bark, or aloe vera leaf gel extract. All of those are very, very soothing and healing promoting herbs. But also we utilize other combination of herbs that can help their emptying of the stomach. So food is not just sitting in the stomach, it moves down into the lower gastrointestinal tract, helping their evacuation of the food. So things like artichoke or ginger. So all of those are your daily foods that you can implement in your diet. So next time you eat, consider to implement the artichoke and ginger in your food preparation and see if that helps your GERD symptoms. So we also like to normalize the acidity of the stomach and add some digestive aids like digestive enzymes or betaine hydrochloride and pepsin when people can tolerate it. Sometimes just adding that will help to tighten their esophageal sphincter and stop their GERD right in place. So replenishing depleted nutrients, as I said, we utilize multivitamins, vitamin C, B complex, calcium, magnesium, zinc, iron. All of those are very, very important for normal and healthy functioning of your stomach. Of course, lifestyle recommendations are very, very important. We want to make sure our clients are in optimal healthy weight. So of course we can heal the gut lining forever, but if we don't address the lifestyle, it might become a virtual or vicious cycle. And how are we better than other conventional doctors that prescribe PPIs? Maybe a little bit better, but we do want to target the root cause. So maintaining healthy weight, controlling your portion, eat small, frequent meals rather than less frequent and large meals. Reduce foods that are not really good for us, like as I mentioned, processed food or fried food, starchy food. Make sure you sit upright while you're eating and stay upright or sitting or standing for at least 1 hour after eating. You know, in Ayurvedic medicine, there's a rule that you have to make 100 steps after your meal before you lay down or sit down. That's a really good, simple measures that my patients implement and report feeling better. So remember to walk a little bit after your meal. So one of my patients actually was running in his apartment after the meal, and that would help him not only with the GERD symptoms, but also with his sugar level. His sugar would regulate right away after the meal if he just runs on the one spot. So people get really creative. So also we like to encourage our patients to stop bad habits like smoking or excessive alcohol intake, or eating before bedtime, or try to move your dinner time a little bit to earlier time. But if you can't, at least go for a small walk or stay upright as much as possible. Also, try not to wear tight clothes, especially in the abdomen area. Cut other possible triggers like excessive caffeine intake or dairy product that can also contribute to the GERD symptoms. So, and so I kind of like took you to show you a snapshot of how we're dealing with our patients with their GERD and other gastrointestinal problems. But if you're interested, we do offer our clients this GI health program that involves their evaluation with questionnaire that will be offered to you in the next slide. We do specific testing. We do supplements and lifestyle intervention. We help our patients with the follow-ups, appointments, and testing. And of course, every patient would work with a health coach, which is so important to help you to implement this program, because I can tell you, oh, eat healthy, but what does that mean? That's what our health coaches help our patients. So, and also, it's very important personal involvement in functional medicine. That's what provides our success. Our patients are always motivated. They want to do homework, and we provide a lot of information and education. So together in the partnership, we can make a significant change and prevent or reverse chronic medical conditions. All right, so if you want to take a quiz about GI health and fill out this survey and upload it to us, please take a snapshot of this QR code. All you need to do is to open the camera on your phone and just snap this QR code. And also, if you have more questions, feel free to sign up for the discovery. We always have time to speak with our patients. You can just fill out the Calendly call by contacting the office, or follow me on their social medias where you can always ask questions and get answers. You can also visit my website that is mentioned here, drelenaKlimenko.com, sign up for our newsletter, and follow the blog post. And if you are suffering from a GERD, we are offering this really great bundle that includes mastic gum and more, which is excellent antimicrobial, specifically for H. pylori. It reduces the H. pylori load, improves patients' GERD symptoms dramatically, and the gut integrity that has all those beautiful herbs that I mentioned and nutrients that have to soothe and heal the gastrointestinal lining. I have it actually right here on my desk. So, but this is a great bundle for you to try, see if it helps. Maybe you can address all your issues just by trying these two products. And you can go to my website and find the store link and you'll get it. Also, we're offering summer sale for N-acetylcysteine that is great for detoxification. It's a glutathione precursor, and also gut integrity is also on summer promotion for 25% off. It's a great deal if you are taking and liking these products. And also, I would like to announce launching soon a whole gut wellness educational program, online program that you can sign up and learn more about variety of dimension of their digestive health and how to connect the symptoms and lifestyle choices, dietary habits, and how it all affects our health. Because gut is a really a key keystone in our overall health and a key for prevention of um, chronic illnesses, variety of chronic illnesses, not necessarily GERD, but also metabolic disorders, cardiovascular disorders, autoimmune disorders, and even kidney. So if you want to learn more, you can scan this barcode, QR code and get more information on their upcoming program. It's going to be a fun program, consisted of 8 modules. We are working really hard to record it and make it fun for everyone. So take the next step. Of course, schedule the discovery call or sign up for our newsletter, sign up to our Instagram, or just follow, just call us. So here's also something that we implement in our practice on a regular basis. We like to look at people's genetics. We like to understand the blueprint of our clients. And so if you are interested to join the group, it's a one-time fee, $349, that includes the test, 3x4 genetic test, and lifetime attendance, free attendance to the group discussion. I keep going back to my 3x4 genetic test, keep learning more and more about my genetic predisposition and my patient's predisposition, and it helps me to manage my patient's health better. So we also seeing more and more mold illnesses. Unfortunately, mold is becoming angrier and angrier. The toxins in our home becoming a problem. So we do have this upcoming group support circle, introduction to group support circle for mold and toxin. So if you're interested, please feel free to enroll today. Just email us and we'll send you a link. And we are still open for new patients. We do have a short wait list, but remember that friends don't want friends to go to the bad doctors, or friends want friends to go to the best doctors. So if you have someone who you think can benefit from this whole body, whole wellness approach, feel free to refer them to us.